everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as the Nurse with the Difference, and I make learning easy and accessible for students. Today we are going to be talking about nursing management. I have been getting tons of messages like, Miss Mary, what is the difference between nursing care plan and nursing management when it comes to exam condition? How do I go about it? I am stuck, I am confused. So I'm going to be giving you easy ways, easy methods on how to write your nursing management with an acronym known as Apple Desera. So all you have to do is to stay tuned to the end so you don't miss out, because I will be sharing the differences between a nursing care plan and also the nursing management. But before we go into details, kindly click on the subscribe button, turn on the notification button so you don't miss out. Let's go there. Alright, welcome back. Like I earlier said, today we're going to be talking about nursing management. But before I go into details, what is the difference between a nursing care plan and a nursing management? In our previous class, we talked about nursing care plan, right? And normally the questions come, solve in order of priority, theory, nursing diagnosis, develop a nursing care plan. In a nursing care plan, you have to draw a table. It is compulsory. Those table has to have your nursing diagnosis, your nursing objective, intervention, scientific rationale, and evaluation. That is for a nursing care plan. But if they tell you nursing management, they didn't tell you in order of priority, draw a nursing care plan, solve this. They tell you manage this patient from admission to discharge. What is the nursing management? How will you manage this patient? They didn't specify care plan. Then just know you have to use this acronym on the board, which helps me in school when I was writing nursing management for any disease condition. Even the disease condition I don't really know about, seriously. So the first one I have, to remember the word, to know what we're talking about, just remember the word Apple Desera. Apple Desera. This actually helped me a lot. Like seriously, it helped me, and I was able to write a lot. So the first A is assessment and admission. I'm not saying when you get to the exam or you just write all this down and say 1, assessment and admission, 2, this. No, you have to make good sentences with it. This is just an acronym that will give you a guide when writing your nursing management. So like I said, the first one is what? Assessment and admission. So you can say you assess the patient properly if you don't know the disease condition. But if you know the disease condition, you say, oh, I'll have to, your assessment of the patient for temperature, right? For cough, for difficulty with breathing, for blood in the stool, for polyuria. You see those signs and symptoms that is peculiar with that particular disease condition, you assess for that sign. But if you don't know the disease condition and peradventure you come into the exam hall, what will you do? Instead of you to leave the book blank, you say, assess the patient thoroughly for the various signs and symptoms of heart failure. You get? So the other one is admission. No matter what you are going to do, they said admission to discharge. Definitely you are going to admit the patient. Will you admit the patient in a scanty ward? No. So you make a good sentence, but admit the patient in a well-ventilated, calm ward. Well-ventilated ward, free of noise and whatever. Do you understand? But just make sentence with it. You see, we've gotten 2 sentences already, right? Assess the patient of the various signs and symptoms. Then also admit the patient in a well-ventilated ward, free of noise. Are we on track? When we don't know the disease condition. Then another is positioning. Positioning depending on the disease condition. If you know the particular disease condition, or like somebody having difficulty with breathing, you can say, oh, I place the patient in a semi-Fowler's position. When you know what you are managing for, you can say, oh, I place the patient in a lithotomy position, in a prone position. But if you don't, you can say, position the patient properly. We don't leave our book blank. That is our rule in our group chat. Then another is observation. What are you observing? You are observing the vital signs. You will agree with me that no matter the disease condition, as far as the patient is stepping into the hospital, you as a nurse, you are observing. True or false? And you always observe while on duty. So you have to observe the vital signs, the temperature, the pulse, the respiration. Do you need to know the disease condition before you observe? No. So that is observation. Then the other is investigation. You will agree with me that various investigations are being carried in the hospital. Urine analysis, chest x-ray, ECG, EEG, depending on the disease condition, right? So, but if you don't know the disease condition, you can say appropriate investigation should be carried out on the patient. We don't leave our book blank. There's always something to write. Instead of us to get 0, we'll get half. We're happy with it. Then another is diet and drugs. Definitely, no matter the disease condition, your patient has to eat, right? Your patient has to take their medication. So if you don't have idea about the disease, you can say give prescribed medication, serve food attractively, and ensure that this patient takes balanced diet. Is that not 2 points already? Yes. But if you know the disease condition, you can say give prescribed analgesics, give prescribed antipyretics such as this, give prescribed anticonvulsants. You understand? Then when it comes to food, for example, a patient having cardiac issues or heart problem, you can say give food with low fat, with low salt, because you have idea of the disease condition. But if not, serve food attractively, serve well balanced diet for my patients. Are we on track? So we're getting points now for our nursing management. Then another is elimination. When I was in the ward, like in the clinical settings, when a patient is being admitted, they add fluid charts to it. So you have to monitor the fluid intake and the fluid output of this patient. It is very, very important. That is what this elimination is talking about. The next one is comfort. Like seriously, comfort. Comfort is actually very, very easy. It has a lot of points imbibed in it. For example, that's when you talk about tepid sponging. That's when you talk about oral care. That is when you talk about opening nearby windows. That is when you talk about providing a calm environment for the patient. That is when you talk about treating pressure areas, especially when this patient is unconscious. So comfort simply means a lot. So depending on the patient's condition, that depends what you are going to write under comfort. So those your nursing intervention for those particular diagnosis, that is what you put inside what? Inside comfort. So in comfort, you're having more than 4-5 points to drop. So after comfort, the next one we have is exercise. You will agree with me that exercise is very important. You have to exercise. You have to encourage your patient to exercise regularly. It is very, very important, and it is of paramount importance. You don't allow your patient to remain stuck in the bed. Rather, you tell your patient, oh, madam, you have to exercise. You have to walk around. So there are 2 types of exercise. We have the active exercise and the passive exercise. I'll tell you the difference. When it comes to active exercise, the patient is the one doing it on his own. The patient is walking, the patient is dancing, the patient is going out of the ward and coming in, the patient is mobilizing. So that is active, the patient is involved, the patient is doing it on its own. But when it comes to passive exercise, the nurse is helping the patient accomplish that goal. The nurse is helping that patient to carry out that exercise. The nurse is lifting the hands of the patient, the nurse is doing the fingertips to ensure that, oh, they are not stiff. Those are passive exercise. You can see whatsoever the disease condition is, our patients have to exercise themselves, be it active or passive exercise. Then the other one is rest. Yeah, you have to encourage your patient to rest. That is where you're talking about restricting visitors, because too many noise, as we earlier said, aggravates pain. So you have to talk about restricting the visitors coming in with the patient. Then the other one we have is advice on discharge. Like seriously, with advice on discharge, I have a lot of points to give. So at the end of my nursing management, I usually say advise the patient on the following. First, encourage the patient to take their medication as at when due. 2, don't encourage the patient not to stop medication even if they feel better. They should continue with their medication. Then 3, encourage patients to practice good environmental and personal hygiene. 4, encourage patients to eat good food, eat well nutritious food and balanced diet. 5, encourage patients to always come for checkup. That's their follow-up. They should come for follow-up and also come for checkup. 6, encourage patients that when they notice any abnormal change, they should report to the hospital as soon as possible. Right? So these are advice on discharge that you can easily give to your patient and that can easily help you boost your points. For people or individual having difficulty with breathing, you have to encourage them to stay in a place that is well aerated. You have to encourage them to change their jobs if need be, especially if the job is being written in the question. You have to encourage them to change their jobs for better and healthy living. So these are the key points you have to talk about. Then also for patients who just left the theater, who will be discharged, you have to encourage them to reduce stressful activity. So these are advice on discharge that can help you boost your points and also increase your points when it comes to what? Nursing management. So whenever you hear the word nursing management, what should come to your mind is what? Apodicera. To remember at first, I don't expect you to cram everything and put it in your head once. It's not going to stay once. You have to practice it. So take a sheet of paper, write the apodicera and the meaning, place it in the wall of your room. Just place it, do as I say, place it in the wall of your room. When you are cleaning your body, you are seeing it. I bet you when you see it for a week, apodicera becomes part and parcel of you in such a way that whenever you hear care plan, whenever you hear nursing management, you are good to go. I don't even get that. So that is what your assignment today. Write it on a sheet of paper, place it on the wall, and put it in your head in such a way that when you get a question, you will be able to write something in regards to what? Nursing management. So whenever you hear the word nursing management, remember apodicera. Did I make it learning easy and accessible for you? If yes, drop it in the comment section. Thank you very much for staying tuned. Thank you very much for watching our video. Don't forget to like, don't forget to subscribe, and don't forget to drop your questions in the comment section. And also don't forget to register for our Telegram class, because daily by 8 p.m. we take questions of our students and also help them analyze their difficulties and make learning easy for them. See you in our next video. Bye.